MYD Heart is proudly brought to you by NHP. NHP, we are about you.
99 FM. It's time now for Master Your Destiny Heart, and we have the illustrious opportunity to actually have on the line Dr. Lughano Ndovie, who is a qualified fertility specialist. He's based in Rundu, and he's on the line right now. Dr. Ndovie, how are you doing?
I'm very well, Sibyl. Thank you.
Thank you so much for taking out the time to speak to us.
Thank you. It's a pleasure.
So let's just jump straight into it in terms of fertility, because according to our research, male fertility can be caused by a number of factors, really. There's low sperm production, abnormal sperm function, or blockages that prevent the delivery of sperm. What are some of the other factors that can actually contribute?
So thank you very much for your question. And you're quite right. Those are some of the factors that would contribute to male infertility. However, those are the results that the patient would get. So a patient is usually asked to give semen for analysis or to be checked. So then they'll be told that the result, you either don't have sperms, or the sperm count is low, or you have an abnormal sperms. Then the doctor will have to look for what are the real causes of those three factors that you've mentioned. And those are the things that probably people have to be aware of, because those are the main contributing factors to infertility. So when it comes to these changes that I'm talking about in terms of the semen analysis or the sperm test that the patient will get as a result, then the following things are some of the things that would cause no sperms being produced. For example, one may have problems with hormones that are required to be produced for sperms to be manufactured. And these can come about because they've got a head injury, for example, or an infection in the head, or they've been using things like steroids, or they've got medical conditions like diabetes and hypothyroidism. So those are some of the factors that will affect the production of semen because the hormones have been affected. And then we look at the actual production of the sperms, which happens in the testes. And that can be damaged through infection. And we also know that it can be damaged through treatment, for example, in patients who have undergone radiotherapy or chemotherapy. But also some patients are actually born with an abnormality where they don't have the actual testes, two of them, or it could be one. So then they will not be able to produce the semen. If semen is produced, it has to be delivered out. If there is any obstruction, then there won't be any semen or sperms, rather, that will be able to access. And this can happen when there is a blockage with the tubes that deliver the sperms out. And this can be blocked either through infection, and usually these are sexually transmitted infections. But we also know that in some patients, they are also born with an abnormality where these tubes are not there. Then let me go to the other part where you've got low sperm count. And usually this come about because the sperms have been produced, but there's been an infection. And usually, again, these are sexually transmitted infections. Or a patient who is suffering from diabetes or hypertension, or they're on some medications, these will also affect the number of sperms that has been produced. The common other factor is where it happens in people who are smokers, people who use drugs, people who take a lot of alcohol, and in patients who have been exposed to chemicals that have affected their testes. And in patients who have got abnormal sperms, usually it's because they've got an infection but also they may have a condition that we call varicocele. So all these are the causes for either low sperm count, abnormal sperms, or where there is no sperm at all.
I see. In the African context now, because we don't speak much about this, how common is male infertility, particularly in the African context?
It is actually very common. And if we're looking at the trends in the past 10 years, we see that male factor is actually on a rise. If we're looking at just the figures in the sub-Saharan Africa, if we're looking at the male factor as a cause, it's ranging between 20 to 40%. So we can see it's quite a high number of men that are actually being affected when it comes to infertility. And the common contributing factor is usually sexually transmitted infections.
And in that case, like, what kind of treatment options are then available for men who wish to boost their fertility?
So we may want to look at in a number of ways. So if the factors that we've spoken before, then the treatment will be targeting what is the problem. So if, for example, a patient is on medications for diabetes or hypertension or thyroid problems, we would want to try and properly, what we call, optimize the treatment or optimize the condition that they have, and that will increase their fertility chances. But when it comes to improving the semen production itself, there are medications that patients are given, which are in the form of tablets or injections. And these are usually hormones that will assist in the increased production of testosterone, which we need for sperms to be produced. However, if the condition requires operation, then there are different forms of operations that can be done. And usually these are quite minor operations. So where sperms can actually be taken directly from the testis with a very minor operation or through an aspiration process, so we can use a needle. And in cases where I spoke about, where in men who have got varicocele, we normally do the removal of the varicocele, and that will actually boost their infertility. There are other factors which are very important to look at, and I think I mentioned some of them, things like alcohol, smoking, and exposure to toxins. These are things that patients are usually advised to try and stop. So stop smoking, stop using alcohol or drugs. Those definitely will increase the chances of improving the sperm production. Improving your general health by doing exercise and eating well and having a well-balanced diet. And these are some of the things that we do encourage in terms of improving or boosting the fertility in male.
Oh, indeed. And there's many so-called fertility foods out there, and we just wanted to know about some of the myths. Is there anything that men or even women can do on a regular basis just to boost their fertility?
So, I mean, there are so many products even on the market that are being sold as something that you can use to boost your fertility. There are some that are actually effective, and basically these are in line with improving the elements that are required for sperms to be produced. So it's more or less like supplements that people take, and even the doctors would prescribe those, and those would definitely increase the semen production. But when it comes to foods and so on, it is always important that one is on a well-balanced diet. And eating healthy is a common thing that we encourage when it comes to any medical condition, not only in infertility. So therefore, having a well-balanced diet, eating healthy, those will be definitely some of the things that can generally improve your health And in the end, it can also improve your fertility issues.
Thank you so much, Dr. Ndovie. You really have shed so much light, especially in terms of overall wellness. It's just not targeted to just one thing, but overall wellness can actually boost your fertility. We thank you for your time.
Thank you so much, Sibo.
And that was Dr. Lughano Ndovie, who is a qualified fertility specialist. She's based in Rundu, and he was just taking us through male infertility and how we can be healthier and be much more healthy and fertile.
MYD Heart was proudly brought to you by NHP. NHP, we are about you.